As a kid, summer break is the time for adventure and fun. But as others were learning how to swim and ride bikes, Austin Fields was bedridden, recovering from 2 surgeries to remove a tumor that was growing into his spine.
My first surgery I had, they had to remove because it was my tumor in the lower left flank was growing into my spine. They couldn't remove it all, otherwise it'd cause paralysis. And they removed it. It was the size of a foam football. And mind you, that was only part of it. Later that same year, it was growing back into the spine, and the part they removed was the size of a golf ball.
Fields was diagnosed at a very young age with neurofibromatosis type 1. It's an inherited genetic condition that significantly increases a person's risk of developing tumors. Fields' condition has an added component called plexiform neurofibromas, which means he developed benign tumors along his nerves. This subtype is also known as NF1-PN. Dr. Angela Herbie, an oncologist, says that this affects just over 100,000 Americans today.
One of the most common tumors that these patients develop are plexiform neurofibromas, and these occur in about half of patients with NF1. And plexiform neurofibromas are tumors that arise from multiple nerve roots, and they cause a lot of pain for patients. They can also be very disfiguring depending on where they are. So I certainly have patients where the tumor is basically doubling the size of a leg. And you can imagine how difficult it is for somebody to even find clothes that fit when they have a tumor like that. And then for some of the deeper tumors that are more internal, they can push on organs and they can actually cause organ damage. So these are a big problem for patients with NF1.
Herbie is an associate professor of medicine and director of the Adult Neurofibromatosis Clinical Program at Washington University School of Medicine in St. Louis. She says that the main complaint these patients have is the pain these tumors cause.
Remember, these are tumors that are involving nerves. And so they'll often complain of just unrelenting, shooting electric pain. Sometimes it can just happen spontaneously. Sometimes it's every time the tumor is bumped, the patients have pain.
But pain isn't the only worry for many of these internal tumors. These masses can cause a lot of issues for the surrounding organs.
You can have big tumors within the chest that are pushing on the lung that can make it more difficult for patients to breathe. You can have tumors that are within the abdomen that are kind of pushing on the kidneys. And so I've seen patients have kidney damage, from these tumors. So there's a wide range of things that can happen.
Aside from the physical injuries, there's an emotional aspect that many patients face if their tumors cause disfigurement.
I have patients that have tumors on their face or their neck, just are very disfiguring. Sometimes they're around the eye to the point where a patient can't even open their eye because the tumor is just sort of enveloping that area.
We called my tumor Ralph, the runaway mouse, and you can actually see it pushing up against my skin and lower left flank. So I could actually show it off and show people. And there's times to where people would say, "What's that on your back?" when I would be like at the swimming pool or stuff, because you could easily see it.
Since these tumors are present from birth, some kids with NF1 are navigating the pressures of school and social circles with the added hurdle of looking different than their classmates.
Kids can be mean a lot of the times, right? So I think a lot of patients have issues with bullying. And then even the tumors that you can't see, when they're causing a lot of pain and kids can't do the same things that other kids do, they can be teased and bullied for that as well. And that can even transition into adulthood, right? You're not able to do the same things that somebody else can do. And if you visibly can't see the problem with somebody, then, a lot of times other individuals don't understand that. They don't give people that grace. And obviously all of that stress can lead to depression and anxiety. So those are big problems that these patients deal with.
Fields remembers having to sit on the sidelines during gym class and missing out on baseball practice after school. It was hard to fit in when none of the other kids had regular meetings with the school nurse.
There's quite a few times that we'd be out during summer and I'd still have training wheels on and I'd kind of get made fun of. And there's one other kid that had training wheels on, but he said the only reason he had them on was because he had a broken arm. So, there's still like little things from my childhood that have stuck with me from that have kind of made me just randomly remember that had disappointments in my life because of, issues I've had with my tumors.
Thankfully, Fields was surrounded by a great support system. His parents and doctors always made sure he was an active member of his care team, understanding his condition and not sugarcoating the experience. Knowing his limitations gave Fields the freedom to push himself in a safe way. He was taught how to advocate for himself and take control of his journey.
I would always try to push my own limits. The doctor at the time I had would actually even challenge my parents that I'm the only one that knew my own limits, that I can push myself a little bit further. And sometimes it's good for me to push myself further and fall on my face, just be there to support me and just be there and try things. And don't be afraid to tell other people about my condition. So if they're making fun of me for something I can't do, explain to them why I can't do it.
With NF1-PN, Herbie says the tumors tend to grow the most during childhood. This rapid growth may be why Fields had to have 2 removal surgeries on the same tumor in 1 year. But as patients age, the rate of growth tends to slow.
They sort of plateau during adulthood. When we see plexiform neurofibromas growing during adulthood, we're actually worried that these tumors are starting to transform into an actual cancer. So that's a big red flag in my adult patients. But pain is something that can flare on and off for patients, but again, usually manifesting when they're kids and then persisting into adulthood.
So I have a tumor on my lower left flank. I have one at the top of my spine from C6 to T3. I have several all throughout my spinal canal. I have a couple above on my left side of my neck, and I have one in between my first and second rib on the right side. And I may have some in other places. Those are the main ones that we know of. That's the fun part about NF1-PNs. You could have them other places. You just don't really know if they're not really causing problems.
While there's no cure, Herbie says that the most common treatment for NF1-PN is surgery to remove all or part of the tumors. Unfortunately, this option isn't always as effective as patients hope.
Because these tumors are pretty infiltrative, you usually can't get the entire tumor out. And even when you can remove part of it, more than half of the time, these tumors grow back.
Thankfully, researchers have created a non-invasive treatment to manage this condition. This year, the FDA approved the first medication for adults with NF1-PN called Gomekli. There's one other drug for this condition that was approved in 2020, but it's only for pediatric patients.
This medication has been shown to significantly shrink these tumors and also reduce the pain that patients have. Every medication comes with side effects. The most common side effects for this medication being GI side effects like nausea, vomiting, diarrhea, and then rashes, especially an acne-like rash.
This is a major win for the community, but not a surprise to Fields, who's been using Gomekli for the last 5 years. He and Herbie met when he was a participant in the drug's clinical trial. After the first year, Fields was thinking of removing himself from the trial. He had been experiencing some of the side effects and was getting tired of the constant monitoring that was required.
I talked to my mom about it because she's been a part of my care for the longest time. I mean, really my entire life. And she came to that appointment and I was speechless when Dr. Herbie gave me the news. And it shrank my tumor, that one in the lower left flank, 57%. And I was speechless. My mom said, well, that makes your decision easy. It was just amazing and outstanding. I mean, and just the pain decrease I've been on since it too has made me feel a lot better.
4 years later, Fields is now on what's considered long-term follow-up. He's able to stay on the medication and check in every 3 months in exchange for a much more pain-free life. It's not perfect, and there are still days where it's an effort just to get out of bed, but he's able to continue pushing his limits and living the life he wants.
Most recently, I went out hiking and I went on too steep of an incline and I walked for too long period of a time to where I ended up just being so exhausted to where the next day my pain was so bad I couldn't hardly get out of bed. And I had to take a pain pill, and I do not like to have to do that. But to me, it's just one of those things. I knew I overdid it. I went way too far on it because to me, when my pain gets so severe that I am bedridden, that's when I knew I pushed my boundary way too far. And so the next time that I go out hiking, I know that my incline cannot be near as high and I'm going to have to not go near as far.
The hope is that this drug is only the beginning in finding a cure for NF1. The Children's Tumor Foundation offers support and education about this condition on their website, ctf.org. You can find more information about Dr. Angela Herbie, Austin Fields, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.